Hello everyone, let's see etiology of neoplasia. So what are the factors which can lead to neoplasia? These are radiation, chemicals and microorganisms. First, let's see about radiation carcinogenesis. So in radiation, it could be by UV rays or by ionizing radiation. So by ultraviolet rays, UV rays are of three types A, B, and C, where B is bad, which can lead to skin cancer like basal cell carcinoma and squamous cell carcinoma. Whereas ionizing radiation, the most common cancer associated with ionizing radiation is AML, that is acute myeloid leukemia. Most common thyroid cancer which is associated with ionizing radiation is PCT, that is papillary carcinoma of thyroid, and leukemia or cancer which is never associated with radiation is CLL. Second is chemical carcinogenesis. So Sir Percival Pott, who was the person who found out that chimney workers were coming in contact with the soot, that is burned remained of the material, which was the probable cause of scrotal cancer. So for the test for the detection of chemical mutagen, the EMIS test is performed, where we take the Salmonella strain and we give a limited amount of histidine to grow. So it will only grow in very less amount, but if we put the mutagen X, which could be the cause of the cancer, then this mutagen will lead to the changes in the genetics of the salmonella, making it independent of histidine for its survival. So even in the absence of histidine, the salmonella would survive very well. So, so in this test, EMIS test, we need to remember two things. First is it is performed for detection of chemical mutagen, which could be the potential cause of the cancer, and second is the bacteria which is used, that is salmonella. Then another chemicals like alcohol causes hepatocellular carcinoma, oropharyngeal carcinoma and laryngeal carcinoma. Asbestos most commonly causes adenocarcinoma of lung, and most specific cancer caused by asbestos is mesothelioma of the lung. Benzene causes AML, benzidine causes urinary bladder cancer. Then DES, that is diethylstilbestrol, which is a banned drug previously used by pregnant mother for normal vaginal delivery, causes the uh, clear cell tumor of vaginal tract in the daughter of the pregnant mother, which is also known as DES daughter. Similarly, if there is the intake of pesticide somehow by the pregnant mother, then it will lead to testicular dysgenesis to the son. Then this is known as pesticide son. But there is no occurrence of cancer. This is just relevant to DES daughter. Like there is DES daughter, similarly there is pesticide son. Then estrogen will cause endometrial cancer, OCP, that is oral contraceptive pills, can cause cervical cancer, tobacco can cause oral lung and renal cell carcinoma, cadmium can cause prostate cancer, and chromium, nickel, cobalt and radon, all these four can cause lung cancer. Then chemical carcinogens like VAT, that is vinyl chloride, vinyl which is predominantly found in PVC plastic, arsenic which is found in pesticide, and Toretto rest, that is Torius which is present in contrast dye. All these three individually can cause angiosarcoma in liver. Now let's see microbial carcinogenesis. Bacteria Helicobacter pylori can cause gastritis and ulcer. Along with this gastritis and ulcer, Helicobacter pylori can also cause gastric adenocarcinoma and gastric maltoma, that is associated with maltoma is a type of lymphoma. So carcinogenesis of this two cancer is by CAGA and VACA, which is a previous year question. So how the Helicobacter pylori can cause gastric adenocarcinoma and gastric maltoma by the gene KAGA and VACA. Diagnosis. So we can perform three tests. First is Wartin-Sterry-Silver stain, where this organism will appear black in color, Steiner stain, which is also a silver stain, and modified Giemsa stain, which is faster stain too, which has faster procedure, and the organism will appear blue in color. Then fungal. So Aspergillus flavius, which is a fungi, also known as AFL, which has aflatoxin, which is present in contaminant groundnut and peanut, which are stored in moist container for very long time, cause mutation by codon 249 of P53 gene, and it will lead to hepatocellular carcinoma in liver. So for the remembrance, P53 gene and 3 is preceded by 2, 5 is preceded by 4, and 9 if reversed, P if reversed we get 9. So 249 codon of P53 gene leads to Aspergillus flavius infection. Then parasitic, so it can be remembered by SS and CC. Scostioscoma hematobium by metaplasia most commonly causes squamous cell carcinoma in urinary bladder, then the transitional cell carcinoma in urinary bladder. So S for S, scostioscoma hematobium, which is by metaplasia, most commonly causes squamous cell carcinoma in urinary bladder and can cause transitional cell carcinoma also in urinary bladder. Then clonorchis or opithorchis, which causes cholangiocarcinoma in gallbladder, C for C. Then viral, HBV and HCV virus are caused by HBX gene, which lead to hepatocellular carcinoma. Then HHV8, that is human herpes virus 8, causes Kaposi sarcoma, that is vascular tumor, PEL, that is primary effusion lymphoma, and can also cause Castleman disease, but Castleman disease is not a neoplasia. It is a lymph node disorder which is associated with lymphadenopathy, fever, and weight loss. On microscopic examination in Castleman disease shows hypervascular type plasma cell type. In hypervascular type, there is onion skinning of lymphoid cell where it appears like lollipop follicle known as mantle zone. Then in viral, the another type is HTLV1, human T cell leukemia lymphoma virus, which causes ATLL, that is adult T cell leukemia lymphoma, via TEX gene. This is a type of cancer. And another non-cancerous condition, tropical spastic paraparesis, is also caused by HTLV1 virus. So ATLL on microscope shows clover leaf-like nucleus. Now the most important HPV, that is human papilloma virus. So there are two types of HPV, low risk HPV and high risk HPV. Low risk HPV is 6 and 11 and high risk HPV is 16 and 18. Low risk HPV, which is 6 and 11, causes warts, condyloma acuminatum, whereas high risk HPV, that is 16 and 18, causes squamous cell carcinoma of cervix, penile, anal, larynx, and esophagus. Now, how this HPV virus looks: it contains L1, E2, E4, E5, E6, and E7 genes, where L1 codes for L1 caspid, which is used for HPV vaccine preparation. E2 it acts as a controller and silence all these genes. Then E4 and E5 are responsible for making cholocyte. It is a special type of cell which contains very dense racenoid nucleus, empty cytoplasm around the nucleus, which is called perinuclear halo, which has empty appearance, and peripheral dark pink cytoplasm. Then E6 is inhibitor of p53 gene and E7 is inhibitor of RB gene, and these two are responsible for causing cancer. Then EBV virus, that is Epstein-Barr virus. This virus attacks the B cell at ED21 or CR2 receptor, and the virus contains LMP1, EBNA2, and viral interleukin 10. So, LMP1 gene causes it acts on CD40 ligand. Then EBNA2 increases cyclin D and increases SRC proteoncogene, and viral interleukin 10 is anti-inflammatory. So anti-inflammatory and 10, interleukin 10 has anti-inflammatory property. So EBV virus attacks the B cell at the receptor, and the B cell will call CD8 T cell. This CD8 T cell will develop ballerina skirt appearance called as Downy cells. So remember, the B cell itself does not develop the appearance. On attack by EBV virus, the B cell will call CD8 T cell, which will develop this appearance. EBV causes infectious mononucleosis, kissing disease, and glandular fever. So glandular fever, because of the enlargement, it leads to enlargement of salivary gland lymph nodes, and it also leads to hepatosplenomegaly, and it is known as kissing disease because it spreads by close contact. So now the diagnosis of EBV virus is by Paul Bnol test and monopost test. The recently used test is monopost test. EBV virus causes carcinoma, that is nasopharyngeal carcinoma, and gastric carcinoma. Gastric carcinoma is most common. EBV also causes lymphoma, that is Hodgkin lymphoma, which is mixed cellularity, and another non-Hodgkin lymphoma, which is Burkitt's lymphoma, DLBCL, and post-transplant lymphoma. It can also lead to sarcoma like LMS, that is leiomyosarcoma. So that's all for now. Thank you.